Welcome back. Gun violence is a public health issue. That's according to the state's health department, which is now taking measures to address it, even creating a new department to focus specifically on this ongoing crisis. NBC Connecticut's Jane Caffrey sits down with the Commissioner of Health for our series, Tackling Gun Violence.
When you think about public health, you may think about disease, epidemics, or smoking. Now in Connecticut, there is another crisis: gun violence.
Unfortunately, we face all forms of gun violence.
Commissioner Manisha Jutani says the Department of Public Health's designation of gun violence as a public health issue is important when it comes to tackling the problem.
When you take a problem and view it through a public health lens, you actually are taking data and looking at interventions that show that the evidence base shows that it works, and then funding things accordingly and then evaluating it.
And those are the concrete steps a brand new DPH office will be taking on.
I wanted to create an Office of Firearm Injury Prevention. Really, it's in this last year that we took that initial support from the legislature to say we think the Public Health Department has a role to play in this. 3 employees are already hired: a program leader, a health program associate, and an epidemiologist. This comes after gun-related homicides in Connecticut soared during the early years of the pandemic, increasing by 36% according to DPH. Then, in the 2022 legislative session, lawmakers appointed $2.5 million in American Rescue Plan funds to DPH. In 2023, the department got another $32.9 million, this time in state funds. Really thrilled to see the state put that investment in us.
Now DPH is distributing that money as grants to community-based organizations working on intervention. Last year, 7 organizations statewide got more than $88,000 each. They're helping gun wound victims at hospitals, supporting young mothers at high risk of being injured, even taking inner-city kids to farms for therapeutic connection to animals.
Who are the people that are affected? What are things you can do to intervene? You double down on those efforts and you start to see things going down.
The new Office of Firearm Injury Prevention will need to address other types of gun violence going forward, including intimate partner violence, mass shootings, and suicides.
We need partners from across the spectrum: law enforcement, judicial, public health. This isn't a problem that can be solved by public health alone. I'm just saying that public health also has a voice to bring to this.
For NBC Connecticut News, I'm Jane Caffrey.